This morning on our special month-long series, Take Charge Today, a little shot of Botox. It can smooth out those fine lines or crow's feet, and now it's being used for other reasons as well. But is it right for you? Take a look.
Keep young and beautiful. It's your duty to be beautiful.
We'd all like some. A shot from the fountain of youth to help us look healthier, happier, younger. One top-notch discovery is Botox, considered a miracle drug used to soften wrinkles.
Botox is a protein made by a bacteria.
A bacteria known as botulism, which is safe for reducing wrinkles.
Once it wears off, there's no residual effect from Botox. It completely reverses itself.
We asked two New York cosmetic dermatologists to give us a breakdown on Botox.
Most people are coming to me because they want to avoid something surgical.
Tell me what's your flavor.
And according to the American Society of Plastic Surgeons, Botox was one of the top 5 minimally invasive cosmetic procedures in 2005. Truly a big business in staying young, Botox procedures have shot up 388% in the last 5 years.
But there are certain types of wrinkles that Botox pretty much has the monopoly on.
It can be used for facial wrinkles, forehead, in between the brow, crow's feet.
But a little dab will cost you. One bottle is approximately $500, not to mention the doctor's fee, which is around $350.
You really want to focus on the structure of the face.
Dr. Paul Frank is treating his patient Aviva with a few Botox facial treatments.
You're not purchasing a drug, you're purchasing the way the drug is done. And if you look at the facial structures and wrinkles as like a marionette on string, we could play with the structures.
This is a bit like wearing makeup. It's a little enhancement and it makes a big, big difference.
Botox isn't only used to treat wrinkles on the face, it also combats excessive sweating.
I often have patients only coming in once a year for Botox in the underarm and doing quite well.
For 5 years, Laurie Klinow has used Botox on her face. This time, she'd like to try it on her underarms.
I sweat more on the excessive side.
When you're doing things for cosmetic purposes, it doesn't always hurt as much as it does when you have to have it done for a medical procedure.
With quick, relatively painless treatments, Botox is giving everyone a reason to smile.
On a scale of 1 to 10.
It was a 2.
It was a 2.
And Dr. Deborah Wattenberg is a cosmetic dermatologist and associate professor of dermatology at Mount Sinai Hospital here in New York. Good morning.
Good morning.
Good
How
to
are
see you.
Great to see you.
So let's talk about the new ways that Botox is now being used. Excessive sweating in particular. I think that's so interesting. How do you, first of all, diagnose somebody who has an excessive sweating problem? I mean, it's a hot, humid day. We all can be...
Absolutely. Sweating is a big problem for a lot of people, and excessive sweating is usually diagnosed in somebody who sweats more than the norm. If you use antiperspirant and you find yourself sweating more than the average person, you sweat through your normal clothing, you feel like you need to change in the middle of the day, or you get infections because you're perspiring regularly, or you can't have a job that requires you to be outdoors because you're concerned about the excessive sweating, you're going to become socially isolated, you're going to become uncomfortable. People sweat excessively on their hands, on their feet, on their underarms, and Botox is a great treatment in order to eliminate that for people.
Okay, and what is the norm? You were sort of trying to demonstrate here.
The norm for some people might be approximately 1 small bottle of water on an average 24-hour day. An excessive sweater may sweat up to 5 times more than the average person. And so they're really perspiring more than is absolutely necessary to maintain their normal body temperature, and they don't need to sweat that much.
So how does it work? You would get Botox shots in your underarms, on your palms?
Absolutely, and it sounds horrible, but it's really not that bad. We do injections into the underarms after doing, let's say, a sweat test where you paint the area with a little bit of cornstarch or a little bit of iodine in order to identify the area, and then you do the injections, and the Botox prevents the sweat from being released from the sweat glands only in the area that you inject. So if you inject the underarms, you won't sweat there, but it won't stop your injections or your sweating from your chest or your back or your hands or your feet.
And you're sure this is okay? Because it seems so counter to, I think, what we've always thought, that ultimately you're sweating out toxins and things that are bad for you, and sweat is a good thing.
Sweat is a good thing as long as it's done appropriately. If you're sweating more than the average person and you're sweating more than you need to, you might actually become dehydrated, you become uncomfortable, you can get infections, as I said. So the reason you would want to do this is to try to avoid that from happening.
And no question, going back to just Botox more generally, popularity has exploded. Everybody's doing it. Are there downsides that really we don't give enough attention to?
Botox is like any other medication, and there are side effects like there are from taking any other drug. The main side effects from Botox, however, are bruising. Bruising is more common in those who take aspirin and vitamin E. A small percentage of people might get flu-like symptoms. They can get headaches. They can get, reactions as a result of the area you inject. If you inject the furrow in between the eyes, you're going to get the inability to furrow. Underarms, you're not going to sweat, but most people actually do incredibly well with it.
And the key is to just not take it too far so you don't get that sort of immobilized face look.
Absolutely. You have to be very careful. You have to go to a trained professional to make sure they know what they're doing. You don't want to have too much injected in your face.
Dr. Deborah Wattenberg, good to have you here. It's good information. Thanks so much.
Great. Thanks for having me.